I'd like to talk to you today about smile transformations and in particular broken teeth. When someone comes in with broken teeth, it's normally not just broken teeth. It could be grinding, it could be erosion, it could be decay. And what we need to do is find the cause of the problem first. Once we know the cause, then we can start creating a beautiful smile. I'm going to talk you through a case, Joanne. She actually came to see us from another dentist. A dentist referred her to the practice, and it was a very complicated case. There was a lot going on in her mouth. When we look at her teeth, you can see that her teeth are not the right level. You can see that her teeth are very worn down. She's lost a lot of enamel. There's decay on the lower left-hand side here. So what she requested was really to create a beautiful smile. So the first thing we wanted to do is make sure she was happy with the colour of the teeth, and we did teeth whitening on her. You can see the huge contrast here between the top and bottom teeth, and it really shows you what whitening can actually do. Once we get the colour of the teeth correct, she wasn't doing any work on the lower, we're only doing work on the upper, we can then match to these new white teeth. We do a diagnostic model of her mouth, so we take a model of her mouth first, and from that model we then plan of what her new smile is going to look like. The red lines are actually gum lifts. It's very important when we're doing cosmetics not only to look at the white aesthetics, but also the pink aesthetics and make sure that everything's balanced. So the red lines actually give me an indication of the amount of gum that I need to actually lift in order to make the two front teeth look the same height and same width. I know it doesn't sound very pleasant, but gum lifting is very routine, it's painless, and most patients will not even know that it's done. From here we do our diagnostic wax up and we're planning her case. So Joanne comes in and she'll know exactly what shape and colour of teeth that she wants, and we really want to make sure that we give her the smile that she wants. So what we've done here is we planned everything on a model of her mouth, and we're going to use this as her trial smile. On the day of treatment, this is what her trial smile actually looks like. You can see she's picking up a mirror here and looking at a smile for the first time, and it's a really nice balanced smile. We really want her to use this trial smile for at least 2 weeks. We won't feedback. We want to make sure that she's 100% happy, functionally, cosmetically, but also phonetics, because anytime we change people's front teeth, there can be a change in the way that the words are pronounced. So we let that go for about 2 weeks to make sure that she's 100% happy. If she's 100% happy, we create that in porcelain. So these are porcelain teeth. They're beautiful porcelain veneers and crowns. And on the day of placing them in, this is just when we're doing our bonding process, and this is critical. When we're doing bonding to teeth, one of the problems of doing bonding in the mouth is that there's a lot of moisture. There's bacteria around and there's moisture around, and you know that saliva in our mouth carries a lot of bacteria. If we get contamination of our bonding process, either the porcelain will fail or the bond will fail and the porcelain will actually fall off. So what we've done here is we've used this purple shield to isolate the teeth away from the mouth, and it enables us to keep a very clean environment for us to be able to bond the porcelain to the teeth. This is her when she's just finished having her bonding done and she's having a feel of the porcelain. Glazed porcelain is very smooth, it's like glass, and a lot of patients, when they actually get their new teeth, the first thing they'll do is they'll run their tongue on it, but they'll also run their fingers on it because they can't believe how smooth the teeth are. This is her before, and this is a photo after, just after treatment, and this is a portrait photo. If you have any questions, please send me an email at adriancat@mac.com, or you can always give us a ring at 1-800-SMILING. I look forward to seeing you in the practice.